Okay, so there seems to be a big trend going on with social media about everyone having Botox in their lower face. Now, Botox can be very beneficial in the lower face, but in only a very few cases. When we look in the mirror, a lot of us go, oh, I'd really like that lift. And because the problem is, as we age, we develop the jowl and the fullness and the loss of definition in the jawline because the face has dropped. Now, what you have to understand is why someone has aged in a particular way, what is going on. Now, Botox relaxes muscles. So if the reason for this all coming down here is due to the muscles over contracting, then by relaxing those muscles, it will help lift. But this is rare. It can be seen in the very early stages of aging, and that's where Botox can be beneficial. But most of the time, unfortunately, it's due to gravity and loss of volume and fat in the upper part of the face. Botox is not going to touch it. And again, you've got to be really careful in the lower face because you can paralyze muscles that function the mouth, and this can lead to really horrible side effects that you're stuck with for several months. So again, unfortunately, there are many practitioners who are very poorly trained. They're not taught to understand the aging process, and every face, of course, being different. So what works for one person won't work for another. And therefore, I'm seeing a lot of patients coming in who have had Botox in the lower face, which has done absolutely nothing, and I'm not surprised. So again, in my experience, and my advice would be, make sure your practitioner has got lots of experience, and in order to keep it at its safest, keep it medical.